house, 22 Maple Street?
Yes, it is.
Hi, my name is Hassi. I'm one of the community nurses. I'm here to help you with the administration of your medication. Is it okay if I come in?
Yes, of course.
Just before I come in, can I ask if there's any children or pets in the house that I need to be aware of?
No, we don't have any.
Great, thank you. So I'm going to close the door, but I'm not going to lock the door for my own safety and your privacy and dignity. So Steve, before we start, I need to confirm your address and your date of birth. Is that okay?
Yes.
So what's your name?
Steve Raj,
What's your address?
22 Maple Street, Northampton.
Great. Is that in NH7 1HD?
That's correct.
Lovely. And what's your date of birth, Steve?
3/8/1982.
And can I just ask if you have any allergies?
No, I don't have any allergies.
So Steve, as I said before, I'm here to help you with administration of inhaler. I understand you've been suffering from asthma, so we're hoping that this inhaler is going to help you with your asthma issue. So Dr. Ravi has prescribed your medication this morning to be given at 12, which is now, and that is for 200 microgram of salbutamol, and it's signed by your GP. The prescription is valid, signed, and legible. Steve, is there anywhere I can perform a hand hygiene, please?
Yes, I have an alcohol gel on the table.
Great, thank you. So I'm going to gel my hand based on WHO guidelines. Now that I've cleaned my hands, I'm going to use the PPE that I have brought with myself. Starting the apron first, and then use suitable gloves. Mr. Examiner, is my tray disposable or reusable?
Disposable.
The tray looks visibly clean, so I will put my medication inside. The medication box looks intact, dry, and in date. The metered dose inhaler looks intact, dry, and in date. This is my spacer. Mr. Examiner, my spacer, is this cleaned in last 24 hours or is it brand new?
It's brand new.
It looks intact, dry. My medication now is ready to use. Steve, can I assist you to sit in an upright position?
Yes, we can.
I'm just going to bring this cushion up because your neck needs to be in a neutral position, not extended and not bended. Thank you. Steve, your inhaler comes in two pieces. One is your mouthpiece, which you have to connect it to the canister, and you hold it like this. You have to connect the metered dose inhaler to the end of your spacer, and then you take the cap off. Now it's ready to use, okay? Steve, there are two different ways of taking this inhaler. The first one is called single breath technique, which you have to breathe for 2 to 3 seconds and then hold your breath for approximately 10 seconds. And then you remove the multi-dose inhaler from your mouth and you exhale very slowly. Steve, the second technique is tidal breathing or multi-breath technique, when you have to breathe in and out steadily for 5 times. That is good for someone who cannot hold the breath for more than 5 seconds. Which one do you prefer to go with?
I would prefer the second technique, please.
Right. You need to make sure that you shake the inhaler for 2 to 5 seconds. 1, 2, 3, 4, 5. You attach it to the end of the spacer. You make sure your chin is slightly lifted and you exhale completely. And then you grasp the end of the spacer with your mouth, lips, and your teeth while I depress the canister. Breathe in and out 5 times. 1, 2, 3, 4, 5. And remove the canister, and you're going to exhale very slowly with pursed lips. Steve, you were prescribed 200 microgram of inhaler. That's why you press the canister once. You need to make sure you wait 30 to 60 seconds between inhalation if you're using the same inhaler, or 2 to 3 minutes if you're using different medication. And make sure you're shaking the canister well. Okay, Steve, now that administration of your inhaler is done, you need to make sure you wash your spacer with soapy water and leave it to air dry. Okay?
Okay.
And I have to dispose of the disposable tray in an appropriate bag. Take my apron off. And dispose my gloves before I clean my hands based on WHO guidelines. Steve, now that I washed my hands, I need to document the drug that you had today, date and sign it. How are you feeling now?
I'm okay, thank you.
How's your breathing?
Getting better.
Great. So I've been here for the last 30 minutes. I'm satisfied that you haven't shown any reaction, but I'll make sure you have my contact details to get in touch if you think you have any more questions to ask, or you think you're showing any signs and reactions, okay?
Okay, thank you.
I made sure the patient has my contact details, and I'm going to close my station by performing a hand eye job.